This PowerPoint is about disorders of sensory function and pain. Some of these items will be in your text, and some are some new things that I've brought out that I thought were important enough for you to know. Somatosensory function provides an awareness of body sensations. It relays information about touch, temperature, position sense, and pain. There are 3 levels of neurons involved in somatic sensation. The first order actually detects the sensation itself. The second order is in the spinal cord, and third order is in the brain. So basically, first you have to detect the sensation, it transmits to the spinal cord, and then up to the brain. This picture just shows you how sensory impulses travel from the spinal nerves to the spinal cord, and which areas of the cord support the different areas of the body. Some terms that you need to be familiar with. For those of you who are in health assessment, you probably know this already. For those who are not, you will eventually get there. Nociception is basically your ability to feel pain or sense pain. Stereognosis is the ability to sense size and shape of an object without using your vision. For instance, you should be able to determine a type of general object without using your eyes if I put it in your hand. For example, a key. You should be able to feel of that key in your hand and know that it was a key without using your eyes. Proprioception is position sense. This is your sense of where your joints or limbs are and position without using your eyes. For example, you should know if I take your arm and put it behind your back that it is in fact behind your back without your eyes even being open. A couple of differences between acute and chronic pain. Really here you're talking about the duration of the pain. Acute occurs when there's been some injury to a body tissue and there's been nociceptive stimuli activated at the site of local tissue injury. For example, if you had an inflamed gallbladder from gallstones, then you would probably be feeling acute pain to that right upper quadrant there. It usually only lasts for a short period of time, and once they remove your gallbladder, then the pain should be alleviated or gone. Chronic pain is a little bit different, also associated with injury to body tissues, but lasts a longer time and may or may not actually be resolved. There usually will be some other associated symptoms that go along with that, like a loss of appetite, insomnia, or depression. One of the best examples that I have of chronic pain are people who have chronic back pain from degenerative back disease or disc disease. You can have surgery on those, but a lot of times surgery only helps the pain a little bit. Sometimes they still have pain or the pain comes back or whatnot. If you take somebody who was working a full-time job, maybe with manual labor, and now they've hurt their back, there's a chance after surgery that they're not able to go back to work. So with that, they're having to take pain medicines. They don't want to eat. They may become depressed because now they can't work. Lots of different things can go along with that. Types of pain and how you can describe pain. There is cutaneous pain, which is basically that happens superficially on the skin. Everybody's had a paper cut or some type of minor cut to your skin and know what that feels like. Deep pain, of course, is a deeper sensation, usually goes along and causes swelling and pain to the surrounding tissue. For example, for any of you who have torn an ACL or some type of ligament, that usually is described as a deeper pain. Not only is it going to hurt right there at the side of the ligament, but your whole knee is probably going to be black and swollen and whatnot. Visceral pain is usually that goes along with a lack of blood flow. So your ischemic type pains, such as what goes along with a myocardial infarction, those people who describe a pressure pulling type sensation would be experiencing some visceral pain. And then last is your referred pain, or what some people refer to as radiating pain. Sometimes you will have pain to a certain area and it actually hurts somewhere else. For example, a lot of people who have gallbladder inflammation or cholecystitis will actually not only hurt in the right upper quadrant but in their chest. A lot of times they feel like they're having a heart attack because that pain radiates from the right upper quadrant up into the chest. Also, people who are having a myocardial infarction actually don't really look at those warning signs, because a lot of times they may not necessarily hurt in their chest. They may hurt up into their jaw, around to the back of their neck, in their back, or down their left arm. So that is referred pain or radiating pain. Now, you can have nociceptive pain, which is that pain that happens with injury to tissues, or you can have neuropathic pain, which is a different type of pain. That is pain associated with a nerve or neurons, and it has different qualities that go along with it. Most people who excuse me, have nerve pain or neuropathic pain describe it as a burning, shooting type pain, almost the feeling that you're on fire, tingling to that area. I've had the shingles before, and it just feels like it's on fire. Because if you think about the nerve and what we said, that those electrical disturbances move down that nerve root, if that nerve is injured in some way, then that's the type of pain that you're going to feel as well, a type of burning, shooting pain. Some causes of nerve pain would be pressure on a nerve, maybe from a slipped disc in the back, physical or chemical injury to a neuron, maybe infection from meningitis, ischemia, or inflammation. There are 3 specific types of neuropathic pain syndromes that are very common, and I wanted you to be familiar with those. The first is trigeminal neuralgia, what we used to refer to as tic-Delarue. Trigeminal neuralgia affects the trigeminal nerve, so just think back from anatomy to where that trigeminal nerve is and what it stimulates, the area of the body that it stimulates. This usually affects the maxillary or mandibular areas of the jaw. These people will actually suffer from facial tics and grimacing that they usually can't control, along with severe pain. It can be brought on by chewing, is usually the culprit there. So they usually have to be careful about chewing gum and whatnot, or they will bring on this neuralgia that will last sometimes for days. The second type is post-herpetic neuralgia. This is the neuralgia, or the name given to someone who has had the shingles and whose pain lasts longer than a month. Remember that shingles is caused by the herpes zoster virus. This is the same virus that caused chickenpox in children. At that point, it was the varicella virus. And for those people who had chickenpox as a child, that virus actually goes to one of your dermatomes and lays dormant until your immune system is down, and then it can reactivate as the herpes zoster virus. People with herpes zoster, or the shingles, will have this burning, shooting, tingling pain followed by lesions to that area of the nerve that the chickenpox virus lived in all those years. Now, there's those antivirals now that we have that are wonderful, that can usually treat the shingles and usually do a very good job of that. But for people who have recurrent pain to the area that they had the shingles, we refer to that as post-herpetic neuralgia. The last is phantom limb pain. This is the pain that is associated with someone who has lost a limb, maybe either a hand, arm, or leg. These people actually have shooting, stabbing, burning pains to the area of which the limb was removed. It actually feels like they still have their limb in place, and it is very, very painful. Sometimes it lasts for years, sometimes it'll just resolve spontaneously. I have a good video from someone who is an amputee, a lower leg amputee, that talks about phantom limb pain. Unfortunately, I have it embedded wrong in the PowerPoint, but I will copy and paste that so you can look at that on your own. I'll put that in the folder with the rest of these slides. The last thing we're going to cover here are your headaches, and these are in your book, except for, I think, TMJ. I don't believe that that is included here, but I've included it in this PowerPoint for you. Migraine, headaches, very common, more common in women than men. Most of the time they are unilateral, meaning that someone will only hurt on one side of their head, usually described as pulsating headaches that come around in episodes. A lot of times people with migraines will describe an aura, meaning that they can tell that they are about to have a migraine. Some people describe as having little floaters in front of their eyes. Some people begin to only have tunnel vision and they know that they're about to have a migraine. Most of the time these are associated with nausea, vomiting. Light usually makes them worse. Sound usually makes them worse. Most of the time these people have to go to bed unless they have some good migraine medicine that works for them, and there are several of those out there now. Second type is cluster headaches. These are less common than the migraines. They are more common in men, and they get their name because these headaches happen in clusters, meaning that someone with cluster headaches could have anywhere from 1 to 8 headaches a day for days in a row, sometimes even months, and then they may just disappear. Sometimes you see these in patients who have other neurological problems such as seizures. These are also usually one-sided and usually go along and have some sinus headache associated symptoms. Usually people will describe pain around one eye and nasal stuffiness on that same side. So if you think about it and you have sinus headaches, that kind of goes along with that. So people mistakenly think they have a sinus headache or are having sinus headaches for days in a row when really they're cluster headaches. Third type is tension type, which is very common, what you're having now because you're in this class probably. These are usually bilateral. They usually don't have any severe associated symptoms. You can usually go on with your activities of daily living, usually resolved with massage or Tylenol, Advil, something of that nature. Last type of headache is that is caused by temporomandibular joint dysfunction, or TMJ. If you think and look and feel as I lecture here at the joint where your temple meets your mandible, that joint needs to be balanced. A lot of people have an imbalance there in that joint, and when you chew or at night, if you happen to be a teeth grinder, then you'll wake up sometimes with headaches because you've ground your teeth and your joint was off balance, and people will have headaches with that. They can make little bite blocks for you if you grind your teeth at night, or if you're severely out of balance, they will usually warn you about not chewing gum all the time and things of that nature so you don't overuse that joint.